Welcome back, everybody, to another episode of Rebellious Wellness Lifestyle. Today, I am presenting two experts in solving knee pain, and they are Tom and Jenny
Yes.
Hledik. And why are they here? Because they've invented something that they say, and lots of testimonials say, can relieve knee pain even in long-term chronic situations. So thank you both for being here. And I just want to tell the people the company's name and the product is called KNEEMO, as in KNEEMO. Welcome. And would you please tell the listeners how you two got together? Where did this all start?
Sure, thanks for having us.
Sure.
Tom, do you want to start on that and we can talk about how we
Oh,
met?
okay. Yeah. It started probably sometime at Stanford in the Silicon Valley, where I had been working for years on study of people's gait with pain. And Jenny came to the lab with a similar interest. And the goal is we're both engineers, and we wanted to provide a device that helped people with knee pain. Because our goal was to use engineering principles to find a new device that would do something better for patients than what was currently doing. And we resonated on that topic. It may have happened over a glass of wine at a party sometime, but at some point, Jenny came and talked to me, and I was happy to find out that she was motivated by similar things. We wanted to apply our expertise to working on things that help people, especially people that were suffering with pain. So that's my side of the story. And when she came, she was my student, a graduate student, and then a postdoc with me for a number of years. And now we went on and invented this device together. We live on different parts of the country. She's in Oregon and I'm in Nevada right now. I've
Okay.
retired from Stanford. I'm an emeritus professor there, but she's doing a great job of helping to promote the device and get it going and doing the things I can't do in terms of marketing it and providing new expertise. So it's great to be working with her, by the way.
Sounds like a great match.
Yeah. And Tom, he didn't say, but so I came to Stanford years ago to do my PhD with him because of how well known he was in this field.
Mm.
Tom has a very long history of studying knee pain, knee conditions, biomechanics. And so I came to do my PhD, stayed for a long time after that to continue working on knee problems and trying to understand why some people get knee osteoarthritis and what can we do to help them if they do, so that they don't necessarily have to go straight to something like a total joint, but can we look at some non-invasive ways of trying to help people to be able to keep doing those activities that they want to do. And we worked in what was a motion capture lab at Stanford for many years, analyzing how people walk and what makes it different that some people progress faster than others, or how does having knee pain affect how you walk and can we impact that?
So outside of lifestyle, aka tennis playing, running, cycling, which involves lots of knee usage, what about foods and things and other lifestyle habits that contribute? We think, my layperson's brain says osteoarthritis happens to certain people because of the habits they have or the genetics they have. Did that enter into does that not matter to this particular device?
Actually, one of the goals of this device is to control obesity by promoting activity.
Oh, cool.
So one of the big risk factors, age is a critical risk factor for osteoarthritis, but obesity is right up there.
Mm.
And so, what happens with aging and getting osteoarthritis, we also put on a little weight as we get older. And there's a kind of a perfect convergence of those risk factors in making the risk for getting osteoarthritis start around 45 years of age and progressing more rapidly as we get older. So yeah, our device, one of the motivations for it was that we saw that people with pain are sedentary.
Mm.
And when you're sedentary, you don't burn the same calories and you become heavier. We don't particularly prescribe diets. I feel pizza is probably the best diet one can have as an Italian.
But and I would say osteoarthritis, it's originally it was thought, right, it's a wear and tear disease, but there are a lot of different aspects, and some of them are the forces at the knee, but of course there's other things. We now know there's inflammatory processes, but we also know that staying active is really important actually for joint health. I think a lot of people think, I need to protect my joint, I shouldn't be doing it. What if my pain gets worse? But the research actually shows it's the opposite, right? You should stay moving to support your joint health. It helps to reduce stiffness, improve flexibility, improve your muscles around the joint that help to support it. It's actually really important that as well. Activity plays into the amount of pain that people have from knee osteoarthritis and even the disease progression and how fast it progresses.
Jenny, you have I'm going to call them bands
Yes.
there with you. And if you'll just show people what they look like, and then either one of you explain the mechanics. How does this work? Two
Sure.
bands.
Yes, I can do that. So these are motion sensing bands. So that it's smart technology. So you put one above your knee, strap it. We have little straps. One goes below your knee. They sense your motion. So they have motion sensing technology embedded within them, circuit boards within them. And so it is analyzing each user's individual motion patterns in real time and then processing that data through an algorithm so that it applies vibration that's specific to your movement. So for example, if you're walking, it's going to apply vibration to the skin around your knee, just where those are, right before your heel hits the ground until your foot's about midway through when it's touching the ground, and then it turns it off and it turns it back on. It'll adjust if you're changing your speed, or if you decide I'm going to go for a jog, or if you're biking, or if you want to do something like pickleball or tennis. So it's actually sensing your motion so that it applies vibration at the right point. Why do we apply vibration? There is something called the gate control theory. And when we developed KNEEMO, we use principles from this. So what is the gate control theory? It explains how a non-painful stimulus, so something like vibration, can actually reduce the amount of pain that reaches our brain. And the way that KNEEMO does this, so it applies intermittent vibration. And in our body, we have neurons that take in all different sensations, right? Temperature, pressure, vibration, pain. And they send the signals to our brain along common pathways, but they send them along either a small or a large nerve fiber. And those transmit signals to our brain at different speeds. So the vibration travels along faster pathway to our brain than the pain travels. And you can almost think of it as like a gate between. So if you're sending a lot of signals that are not painful and they feel good, the vibration, it can gate or block the amount of pain that actually can reach your brain. So we are reducing pain while people are in motion by using this vibration. And then we actually showed that when you do that, you can also improve how people use their leg muscles. So in particular, the quadriceps is really important for your joint health. And when you can reduce pain, you can also improve quadriceps muscle function with this. And we were able to show that in our clinical research that we did. So we're using a blend of engineering, the motion data that we know, as well as neurological principles when we created it to make it work.
This is fascinating to me. And what a fun ride you must have had applying what you've learned in a lab to what actually works in the body. So who is this not a good resource for? Somebody that's had a knee replacement, would they benefit? Because I know my husband's had a knee replacement. His knee still hurts a lot of times.
Actually, one of our longest users, and he's given us a testimony, is a post-total knee replacement patient that has suffered with chronic knee pain after the total knee replacement. And he's one of our strongest advocates for using the device. So and in fact, we just provided a device to an orthopedic surgeon in Chicago that plans to use it for rehab after total knee replacement. Because one of the things we found after looking at a lot of people with different types of treatment is that they adopt a gait pattern that still looks like they have pain to some extent because of this inhibition to use their quadriceps muscle, which is one of the critical muscles of the knee. And in some cases, that's very difficult to rehab. Also, after total knee replacement, there can be some chronic pain that's due to nerve problems. And in fact, this particular patient that we provided the device for has clearly nerve problems, because if we look at the x-rays, it looks like a perfect total knee replacement. So the surgeon is proud of his job, but if you look at the patient walking, he's still got problems and he still has pain. And the pain really limited his mobility to do the things he used to like to do. And by wearing KNEEMO now, which he wears regularly every day for his daily walk, he's able to overcome that pain and have the mobility that he wanted first. So we think that there is a significant population of patients following knee replacement that have this kind of chronic pain that's a bit unexplainable if you look at just the standard things that an orthopedic surgeon looks at in terms of an X-ray.
Mm.
And one of the things I found, because for years my primary position was in an orthopedic department, and I would go to grand rounds and they would show the X-rays and they would feel proud about the way that the knee replacement was placed. And then I'd watch the patient walking down the hallway and they had a limp. And so one of the things that we felt was important was not just to eliminate pain, which is one of the goals, it's to restore function.
Mm.
And because function is related to pain to some extent as
Yeah,
well.
of course.
So that was one of our goals. And KNEEMO works to reduce pain while you're moving. That was what we do with it.
Uh-huh. Is there any difference between the female anatomy and the male anatomy? The bands, I didn't see male, female versions, so I'm guessing one set of bands works for either.
Yeah, it works for either. We have different size straps, so
Okay.
depending on your leg size, different sizes. But no, we did in our initial testing when we were looking this, we did look at different placements of where the vibration was placed around the knee. And so we optimized that early on. And then in our clinical studies, we were able to show we had males, females, that it worked for both genders and for different people with osteoarthritis, with ACL tears, meniscus tears. And we did a small study in post-total knee, just like you were talking about.
Interesting.
Mm-hmm.
And so somebody could, let's just say, so we'll use my husband, the fixed knee that only hurts sometimes, the non-fixed knee, which of course he favored walking on that side for so long, he feels like he's never really gotten back to 100%. Does this help with gait? Because he would say, oh, my knee hurts today, but he won't say that the next day. But if he wore this thing, I'm guessing he's subconscious or he's not aware of the fact that he's probably still favoring one leg or the other. And so this might help him restore some kind of equilibrium.
Yeah,
well,
and
go ahead, Jenny.
I was just going to say, in our clinical studies, we looked not just at pain, but we also looked at just what you're saying. So we had the motion capture lab, we're able to analyze exactly how people walk. We know that some of these conditions, pain is related to a reduction in quadriceps muscle function, and that impacts how you walk, right? That changes. And that happens when you have osteoarthritis. It happens to people who have torn their ACL, even if they have it repaired. You can have it surgically repaired, you're still going to have a deficiency there. If you've torn a meniscus, same. Even if you've had surgery, there can be deficits after total joint replacement. And so we were able to have people immediately wear KNEEMO and see an improvement in quadriceps muscle function. And then we also looked at 4 weeks, and we actually did a randomized controlled study. So we had people wear KNEEMO for 4 weeks. They did a washout, or so they did no treatment for 2 weeks, and then they crossed over to another treatment, which was just off the shelf bands, the ones that just are straps, right? They just apply compression. And we were able to show that after wearing KNEEMO, we had improvements in their function. So improvements with walking. So they had improvements in how they were activating their quadriceps muscles, and also in navigating stairs, which unfortunately, when you have knee pain, can be really difficult going both up and down stairs. We were able to show they activated their quadriceps more going upstairs, and then they had better movement control going downstairs, which it can be scary even in the motion capture lab. You're on the sides of people ready to catch them, right? We saw drastic improvements, and we have some videos of this where it was just to the naked eye, you see them struggling. And then when they were wearing KNEEMO, even after just wearing it, that they were better able to get their motion under control as they went down the stairs, which for us was so exciting and really made us want to pursue this.
Tom, did you want to add?
Yeah, go ahead.
Yeah, what Jenny said was great. She covered a lot. One of the things that we also found that KNEEMO does is it enhances proprioception, which is a sense of how you move. And with pain, you lose some of that. And just as a side story, we tried it on patients that are post-stroke. And what happened there, they have trouble with their gait in determining where their limb is and when the foot hits the ground and how to observe that. If you think about when a child is learning to walk, they use a lot of their sensory input to see where their foot is. They look down on every step. And as they learn more, the body gets programmed for those steps. And that's because of the proprioception or the sense of your joints where they're at. That's automatic. You don't have to think about it at every step. KNEEMO's got the smarts to actually think about it for you because it's looking to detect when that foot hits the ground. So this patient and several others now have reported back that it really helps their gait in sensing their limb position. So when they're trying to retrain their sensory system to locate limb position, improve their gait, it's helped them a lot. And we have a stroke patient that uses it every single day in his rehab to try and restore his normal gait. That goes along with Jenny mentioned on stairs. One of the scary parts of patients with after a total knee replacement, they do lose some sensory input as well. And that's why going down the stairs where they have to carefully look at where their foot is to hit that stair, KNEEMO helps them because it gives them it gives them a signal. That vibration happens at the right time for them. And they get that signal and they feel better going downstairs. It helps activating the quadriceps while going up the stairs. So it has that other little fringe benefit that we're also exploring for patients.
I'm thinking of some friends, people my age in their 60s, who feel their balance is not what it used to be. They're trying, they're doing exercise. We're doing what we can to mitigate that uncertainty, but I do have friends that feel like, oh, I don't want to go hiking because what if I fall over or twist my ankle, this and that. Would this be something that would help them?
Yes, yes. We have some people that just use it for hiking and especially on rough terrain as well. And these are not necessarily older people. These are even the younger people as well. So it has benefited more people than we thought with the device.
Yeah.
And one of the most rewarding things, Jenny mentioned that, in our lab, we can immediately see an effect. We look at someone when they first come to the lab, before they've ever used KNEEMO, and we look at their walking and stair climbing, and we see that limb. You can visually see the limb. And after they put on KNEEMO, try it for a little bit and start walking, you see the walking improved immediately. And especially stair climbing, going up the stairs was dramatic. And that was one of the most rewarding things that I've had in my career to see that. So that was great. Yeah.
So is this a once you have it, you're going to wear it forever kind of thing? Is this a corrective tool?
No, I would say it's more as needed.
Okay.
So I look at it as having, for me, I use a leave after I play tennis because I hurt. Or sometimes I use it before because I know I'm going to hurt. You put it on when you need it. Okay. And the nice thing is you don't have to keep buying it. Once you have it, it's there as needed.
Okay.
And each individual kind of selects when they need it more than others. For me, sometimes it's more after tennis where my knee is stiff. And if I walk around for a short time with it, that stiffness goes away because I'm using the knee the way it should be with the right motions and the right muscle forces. And I get retrained to get over that stiffness and it helps. And I've talked to other tennis players, the same thing. They use it after sometimes tennis as well.
Interesting. Jenny, do you have any use for this or you have good knees so far?
No, unfortunately, former marathoner who has struggled for a long time with knee pain. I've tried the knee bands for years. They didn't work. KNEEMO I use on every run now. I think mine is up to 500,000 steps and counting on the one that I'm using. So it comes with me everywhere I go for every run on all my trips. So no, and the thing that's hard too is arthritis can impact in chronic knee pain. It impacts us as we age, but also there's a lot of people who have knee injuries when they're younger. And if you have something like an ACL tear when you're 20, your risk of getting arthritis, you have a 50% chance of getting it within 10 to 15 years. Wow. So people are needing solutions earlier if you've had something like that. And because you likely don't want to have to get something like a total joint when you're really young because you want to still be active and you don't want to have to then potentially get a revision as you're getting older. We have a lot of people who are looking for solutions that can help them prolong that period. So they don't want to go necessarily the invasive route yet. Or the good thing about this is you can use it in conjunction with other things. If you're getting a joint injection, you want to try that. Maybe it's going to help you. you can use this as well, right? You can still use it to support your joint health and try to be active. We have other people who are using it to help with rehab, which is an interesting one because physical therapy is great, right? It's really important for your knee health, but people can be limited by their pain. If it hurts to do those exercises, you're not going to be compliant with them. So we have physical therapists who are using it to help their patients to be able to better do those exercises so they can have them progress faster. Because really, that's what physical therapists want. They want to see you and get you better
Get
and
rid
get
of
you
you.
out the door.
Yeah.
Yeah.
So any plans for like elbow bands for people that play tennis or pickleball or paddling?
Actually, yes, I'm motivated there because this platform will work for any joint where there's muscular pain. And I have back pain. So I'm working on a device right now using the same mechanism as KNEEMO for the back, but also the shoulder, the elbow, the ankle, all of those are potential areas, yeah, for applying the same technology. Luckily, we have 2 patents on the technology too, so we have some control of that.
This reminds me a little bit of, I broke my wrist many years ago, and they would put, I'm thinking TENS, a stimulating, electronic stimulation kind of feeling thing. Is there any similarity between that and this technology?
So TENS uses, like you said, electrical stimulation. So a different mechanism. We're using vibration, so completely non-invasive. Yeah, TENS, there are certain patient populations we can't use it in if you have pacemaker, pregnant, things like that. And then ours is activated by motion, which to us is what really sets it apart. So for NEEMO to vibrate, you have to be moving. So we're trying to get people to have that benefit of getting pain relief while they're in motion. So keeping you active, which is good for, of course, your joint health, but of course, then our overall health in general as well.
Yeah, for sure.
Yeah.
So is there anything else you want to tell the listeners about it? I think we've covered pretty much everything that I've read about it.
Well, one thing I think would be interesting to know that this didn't happen overnight. We didn't wake up with a dream and say, "Oh, we're going to develop this device."
AI did it all for you.
Vibration and all that. Actually, it goes back. I've been working on this area of knee pain and gait for 50 years.
Wow.
I know I don't look that
No,
old.
you don't. I was just going to say, you took the words right out of my mouth.
Right. But even then, after we came with the idea of what we wanted to do, it was 10 years before we went from the laboratory concept through the testing to a device that we could manufacture at scale and to where we are right now, where we can offer it to the public. Because once we saw the benefit of it, we thought we have to get this out to the public. So I retired from Stanford and helped start this company that is now producing it at scale.
That's great. I hope not in China, but never mind.
No, not.
Not for any reasons but tariffs. I have nothing against Chinese manufacturers. Today was a bad day for Chinese
we went
manufacturing.
through a big challenge with when the chips were not available. There's
COVID.
50 different microchips inside that little device.
Wow.
I always tell people it looks simple on the outside, but look under the hood. It's complex.
True of so many things.
Yes.
Okay, so I want to tell people where they can find the NEEMO is theneemo.com. And as I mentioned earlier, there are great testimonials. There's some information about knee pain, what about treating your knee pain and how this is different. Anyway, lots of good information. And I did not read the CVs of Tom and Jenny, but you can read all about their team there if that's of interest to you. So I want to thank you for being here and for bringing this to my audience because I can already see that there are people that need this, want this, recognize the benefit of it. I am sorry that I'm not going to be a purchaser myself because I'm lucky at this point to have good knees. But when you come up with an elbow one, let me know.
We will.
Thank you again for being here, Tom and Jenny. Appreciate you. And people, I'll be back next week with some 1 or 2, maybe 3 fabulous guests for another episode of Rebellious Wellness Lifestyle.